Commissioners of Board of Health. Adrienne Byrne, Health Director. There's been a few changes in the last 7 days. Governor Kelly released an executive order that banned gatherings of 50 or more in the United States. We were glad to get that guidance because with that came more specifics on what types of events and gatherings had exemptions. You can find that on the the governor's website as well as Sedgwick County website. Schools in Kansas, as of yesterday, are not returning to session for the rest of the year. They are looking at remote learning. That will be coming out. Hopefully that guidance will be coming out by the end of the week. As of this morning in the United States, we have approximately 6,500 cases in the United States and 113 deaths. These are primarily in Washington, California, New York, and Colorado. We have 16 confirmed COVID-19 cases in Kansas. There's still a fair amount of questions on why is all this happening? Why do we have these bans? What's the deal with the 6 feet and social distancing? 3 weeks ago, the United States, 3 weeks ago today, the United States had 14 cases. Last Wednesday, we had 938 cases. This morning, we have approximately 6,500 cases. So it is rapidly spreading. And what we are attempting to do in Kansas is called flattening the curve. If you look at what happened in China, the cases overwhelmed the system in a very short period of time. So they were putting up hospitals. They weren't able to treat the critically ill. Just as we do, we already have critically ill in our hospitals with flu and other ailments. And so by putting these severe measures in the social distancing, we're hoping to flatten that curve. And that curve flattening doesn't mean that we don't end up with as many cases, but the hope is that we slow it down so our medical system has an opportunity to treat those that they need to treat versus not being prepared. So prevention is still the best thing that we can do, and the social distancing is to help keep away from those that are sick. And if someone sneezes or coughs, that you not be close to them. And most people do cover their cough or their sneeze. Children, it can be a challenge with. But the biggest way that this is spread are when someone infected coughs or sneezes, it goes into the air and the droplets settle on surfaces. And then we touch that surface and put our hands to our face. So we've got to keep our hands away from our face. That is the biggest prevention, along with washing our hands with soap and water, doing it thoroughly underneath the nails, in between the fingers, staying home if we are ill. And we have a lot of people calling in wanting to be tested. And I, ask, what would you do if this were October of 2019? Would you be feeling that strong need to go to the doctor or be tested? There's still a lot of other viruses in the community, and we still have the flu. It is rapidly on the decline, but we still do have the flu in our community. The testing criteria, since we do not have an identified case in Sedgwick County, we do not have it identified as community spread. The criteria is still, do you have a recent travel history, or have you come into contact with someone that was positive for COVID-19 and have symptoms of a cough and a fever, and then the more severe is difficulty breathing. So those are still the criteria that we're going to use for anyone calling that wants to know if there's some place where they can be tested as far as sampling. I'd be glad to answer any questions.
Okay, Adrienne. Commissioner Cruz has a question.
So where would we tell people to call?
As of tomorrow, and the biggest strain and challenge in our community and across the United States is the lack of testing supplies. So that is the biggest challenge. More are coming in, and we are at the health department uncovering every stone there is in the U.S. to find those samples, those sampling supplies. So at this time, as of tomorrow, we will have a call number set up for people to be triaged. And triage is when someone calls and they believe they're ill, and we will ask them those questions to see if they do need to go somewhere and be tested. And that number, as of tomorrow, again, because we don't have people on it, but it's being set up, is 660-7425.
Okay. I just want to personally thank you for all the work that you've done. I know that this is not easy, and we are fielding questions left and right, so I really appreciate what you're doing. Thank you so much.
Thank you.
Commissioner Howell.
Thank you, Mr. Chairman. I just wanted to ask you some of the questions I'm receiving, and I don't know how to answer the questions. I thought maybe I could give those to you, and you could publicly speak to them. First one is, I understand that there's a vaccination that started a trial. Can you please talk about how long before, if there's success in that? I've heard some people say it would be a year before we'd see a vaccination available to the public. Is that a reasonable schedule in terms of, even if that, in other words, that's the most advantageous schedule would be about a year from now?
Yes.
Okay. So the idea that there's a vaccination around the corner is probably not quite accurate.
In terms around the corner, it's going to be approximately 12 to 18 months.
Okay, that's good. That's what I thought was the right information. In terms of summer temperatures being a factor in reducing the communication of this disease, is that something that is thought to be real, or is that not?
Some viruses are affected by seasons. COVID-19, now it hasn't been around long enough to really, there's still a lot that we don't know, but at this time it doesn't seem to have seasonal variants, so no.
So this will probably continue, even though the temperatures outside are warming up, we'll still see this probably continue.
That is the belief at this time.
And I'm getting a lot of concern about, is there discussion going on about further reductions in gathering size numbers? Right now it's at 50. Is there discussions about changing that to something smaller?
There aren't current discussions going on about this at this time. Now, if it becomes community spread widely, when you look at other states around the country, you'll see some pretty drastic reductions and curfews and whatnot to try to limit to try to further the social distancing with limiting how much contact people have. But at this time, no, it is 50. Okay.
And then I guess my final question would be, my perception is I think a lot of businesses, obviously government is desirable to be in total compliance as much as we possibly can be in every way we possibly can be. I mean, there's challenges like at the jail, for example. I don't know how you handle some of these things there, but and I think that businesses have done a very good job. But in terms of people's personal choices, I think even they have actually done quite a lot of really good things to try to comply with the intent of these things. But in terms of law enforcement doing some type of forced compliance with those things, has that happened anywhere, or do we anticipate that type of thing happening here?
The hope is that people will make good choices for the community, for the health of the community, and to protect those most vulnerable, so that law enforcement don't have to use resources to be enforcing the ban.
Yeah. I would just say I'm impressed with basically decisions of people everywhere that are making choices to do what they can to help flatten the curve, I guess. And so I think that's the right strategy. So I appreciate those answers, and I think that'll help a lot for people. I'm getting those same questions a lot, so I appreciate those answers from you today. Appreciate your presentation. And I would also make a motion to receive and file.
And we do have a COVID-19 email now that people can send questions to, and they can still go to 211 United Way and ask questions, but we also have been receiving a lot through various emails at the health department, and so have set up a COVID-19 email that if it's not on our website now, it will be today.
Do you know the email address off the top of your head?
I don't.
Okay, that's fine. We'll get that on the website, I'm sure. Again, I thank you for your presentation. I'm going to make a motion to receive and file.
Okay, thank you, Commissioner Howell. Commissioner Dennis.
Thank you, Mr. Chairman. I appreciate it. Counties are the front line of anything that's happening in this arena right now. We have about 3,000 counties across the United States, and we're members of the National Association of Counties. So things that are happening across the United States, some counties are ahead of us because they've had this problem longer than we have and more severe. Yesterday afternoon, NACO held a conference call, and any of the counties that are members of NACO could participate in it. And at that time, Chairman Meitzner, Mr. Stoltz, Mr. Papoon, and Lindsay Poe participated in it. And we just got to hear what is happening in other counties across the United States. And counties in Washington State, New York State are having severe problems. And we really need to learn what's happened with them and how that we can use the lessons that we learned to make sure that we can take care of our folks here in Sedgwick County. I want to give you kind of a brief recap of what I had that I picked up in my notes yesterday. If Commissioner Meitzner or Tom or Mike or Lindsay have anything that I missed that's important, please don't hesitate. But first of all, they talked about some of the aid that is coming to the counties. There's already been one package that has been passed by both the House and the Senate. It was $8.5 billion. Of that, about $950 million of that will go to state and local public health organizations. We need to work with the state public health agency in order to make sure that we get our share of that. We're the largest county in the state of Kansas, so I don't know how much that that $950 million will come to Kansas, but I'm hoping that we can get a good chunk of it here. $100 million of that goes to community health centers directly. And that's to help the community health centers prepare. The rest of the money is for testing and research and development for the future to see what we need to do in the future. That's the first bill, and again, that was $8.5 billion. They're working on a bill right now that's been passed by the House. It is at the Senate. The Senate has promised they're going to work it as soon as possible and get it to the President. That one is H.R. 6201. If you look it up online, make sure that you look for the right one. They passed one called H.R. 6201, but now there is an amended technical version of it that they also passed. So make sure if you look for it, you want any information out of it, why it's H.R. 6201 amended technical. And as I said, it's been forwarded to the state, to the Senate so that it can move forward. What does that do? It's going to provide testing, nutrition, unemployment, some Medicaid help, medical leave. They're looking at Social Security tax and Medicare tax credits for employers. They want to make sure that unemployment is there for the public workers. A third bill that's working through right now also at the same time is even larger. That bill is $1 trillion. And I think we've heard some talk from President Trump last night on what all that carries. But I haven't seen the bill. They hadn't seen it in its entirety on what's going to be in that bill. But again, it's a stimulus package mainly to stimulate our economy. A couple other points. We need to make sure that we work with Kansas Association of Counties because they're all the counties in Sedgwick County or in the state are involved in this. Also with the state public health folks. There's also some FEMA money that's available, and we need to make sure that we take a look at what we can get there. There's $42 billion already available through FEMA. And what that can do is if we need to apply for that FEMA money, there is a form 90-49. You can go on FEMA.org and find out what kind of public assistance that's available through FEMA. The other thing they recommended is to watch cybersecurity because there are a lot of people out there that are trying to make money off of this thing, and we need to make sure that they're not doing something that's going to impact the health of our community. They are putting lessons learned on the NACO website. And this afternoon at noon, there's another conference call that's going to be held, but this is with the White House. So at noon, we'll get some additional information. Then they put on from folks from New York State and from Washington State that's actually gone through this. And so they transferred it from really just NACO at large to NACO specific to see what the states have been facing. In New York, he briefed that 20% of the people in New York that got COVID-19 required hospitalization. Said that employees, especially public employees, may need some mental health issues. So we need to make sure that that's involved. I know we got Joan in the audience, and we appreciate that. We need to pay attention not only to all of the employees that we've got, but our public employees. We're working for Sedgwick County and working with the public sector. We need to make sure that we're supporting them so that they can do their jobs, because they're on the front lines of this thing. Washington State, they got it first, and they were probably the initial brunt of it. The county that was talking is a much larger county than Sedgwick County, but they asked what it cost the county so far, and they said $80 million. That's what it costs the county. So as we're making decisions going forward here in Sedgwick County, we're going to have to make sure that we're making wise budget decisions, and some things that are in our budget for 2020, we may have to take a look at whether or not that we're going to be funding them currently or push them back to the end of the year. And see where we're at financially in this, because I don't see that it's going to cost us anywhere near that large county in Washington State, but I think it is going to cost our county a lot of money, and we need to be prepared to be able to fund that. One other piece of information, and I appreciate that you said that we're going to have a place where that people can go on and ask questions. One of the other recommendations is that one of them prepared a Google document for people to be able to come into and ask questions, and also where that we can post answers so that people aren't having to ask the same questions. So they can go on and they can actually find out what other people have asked, so that we can keep current on the information. So that's a brief summary. I don't know if Chairman Meissner has anything further that he'd like to add, or Tom or Mike or Lindsay. Thank you.
It was pretty good. Plus, one thing, the federal assistance also includes keeping track of all the financial related impacts of, and I'm glad Lindsay was there, and Lindsay's in our finance department doing a great job. They've got it set up to do that, to keep track for whatever the financial impact will end up being. But you did a nice job of summarizing, and thank you. I have just a couple of thoughts. Adrian, again, thanks for your comment. We've had some, all of the commissioners are working hard in their own way to help respond to community, business, individuals. It's important that we have the same information. New territory. One suggestion that I had from a commissioner is that we take a more because it changes so fast. I'd like to suggest that we consider like a daily briefing of some kind. Maybe the manager can maybe figure that out, what might be convenient time, just update our current county, because it seems like the feds are doing great federal information. I'm not sure if we have state impact that changes, and maybe there's no changes, but I think the media and the citizens really are asking for daily update, and that actually would help us as commissioners to have current and accurate information. I think for the public, I don't know, Tom, I don't want to put you on the spot, but also we are discussing, obviously you mentioned test kits and looking at evaluation of remote testing sites or mobile testing sites, maybe temporary shelters, all kinds of things like that. And we don't have finite answers on those. I talked to Susie Santo, who heads up Visit Wichita daily now, and because she's in constant contact with the Visit Wichita is in constant contact with the hotel and the restaurant industry, which is obviously gathering places, and they are needing information. So even this morning, if we can help work with her to, she wants to send out a broadcast from her to restaurants and hotels of what's acceptable or not, the 50 people or not, and all the things that go along with that. So with the public, if we could work towards a daily until this thing settles down a little bit. Tom, would you like to comment on anything else we're kind of trying to work on?
No, there's a lot of moving pieces, Chairman, as you well know. I think a daily briefing is workable. I'll visit with staff. We'll work out the technicalities of how we do that. And it's a similar briefing style that the police department does over at the city every day. And maybe we could even co-join and do something there on a daily basis.
Yeah.
But let me do some investigation.
That might be a good idea, because the media is usually you're usually at the police briefings every day. And sometimes, how long do those go? 15, 20 minutes? Half hour? Maybe we could piggyback on that. That's a good idea. Thought. Anyway, so thank you. If there's any other comments, this is a...
Yeah, I'll second receive and file.
Okay. Thank you. It's been motioned and seconded. Any other comments? Being none, Madam Clerk, please call the roll.
Commissioner O'Donnell?
Aye.
Commissioner Dennis? Aye. Commissioner Howell?
Aye.
Commissioner Cruz?
Aye.
Chairman Meitzner?
Aye.
Thank you.